I am yours, I am yours, I am yours. Send me, Lord, I am yours.
Welcome to the Gospel Center Pro-Life Podcast. In this episode, we're going to talk about a pretty difficult subject, ectopic pregnancy. We think it's going to be an informative and helpful episode, so stay tuned.
Send me, Lord. I felt your passion, I've touched your heart.
Use me, Lord, use me, Lord.
Welcome to the Gospel Center Pro-Life Podcast. Appreciate you guys listening, and as always, we appreciate if you guys would leave us a review on iTunes. I know some folks have asked how to leave a review on iTunes, and look it up, because it's actually not easy, to be honest with you. If you go on iTunes or you go on the Apple Podcast app, it's not easy to find how to leave a review. But actually, if you just scroll down to the very bottom as you're in our podcast, you can scroll down and you can see how to leave a review. 5 stars are great. We like 5-star reviews. They're fun. And they might help counteract some of the 1-star reviews or some of the negative 1,000-star reviews that we've gotten over the past couple of months.
Not from our normal viewer.
Not from our normal viewership, but from some pretty nasty pro-abortion people, which I hopefully in the next podcast we'll read some more of those reviews.
Yeah.
I think it blessed people to listen
They're
to some of
entertaining.
those fun reviews. They are pretty entertaining. But today we're going to cover a subject that I hope will be a blessing to you guys, and it's a question that a lot of pro-life people have, a lot of people on the sidewalk. It's something you're going to run into if you haven't, and you're in ministry on the sidewalk. You're going to run into this. You probably already have. But it's the subject of ectopic pregnancy. Now, right off bat, we're going to make sure and let everybody know we're not medical professionals. I'm not. Vicky is not. And our guest, Lisa, is not a medical professional. So we're not giving medical advice. Mm-hmm. What we're giving is just our experience. Lisa has experience in dealing with moms that have had ectopic pregnancies, but also experience in ectopic pregnancy herself. So she's going to speak from a unique perspective. And we're also going to be referencing an article that I guess we'll put out in the show notes of the podcast.
Right.
Ectopic Personhood from the Personhood Initiative.
The Personhood Initiative. And yes, the name of the article is Ectopic Personhood.
Yeah, and it's a real helpful article. So we're going to be referencing that article some. But we're going to talk really, again, around sidewalk counseling and dealing with the subject of ectopic pregnancy when you're talking to a mom who's going into an abortion center. And we've had volunteers. Vicky, you mentioned before we started this podcast that one of our newer volunteers, one of our questions on our volunteer application is, you think that there's any exceptions that make it okay for a mother to have an abortion? And for the most part, people say, no, there's no exceptions. But this young lady actually said, yeah, but only in the case of ectopic pregnancy.
Right.
And the reality is that she didn't really understand all of the ins and outs of this. You were able to call and talk to her about this. And so we're going to talk about some of that. But we also understand that even within pro-life ministries and with individuals, there's differing opinions and views on ectopic pregnancy. And we're not going to pretend to solve all of that because it is a pretty actually difficult question to really try to just answer. And here's the exact answer to it. But I think we're going to give you guys at least some information that you can process, you can pray about, and that will help you in dealing with moms who are considering abortions because they've been told that they have an ectopic pregnancy. So that's a long beginning to hopefully a good discussion about ectopic pregnancy. But Lisa, real quick, just introduce yourself. And just so you folks know, Lisa has been involved on the sidewalk for a long time. She's going to share a little bit about that. And she and her family were instrumental in starting Cities for Life back in 2010 or before that. So, but introduce yourself with your own terms there.
Sure. My name is Lisa Metzger, and I am a second generation sidewalk counselor. Okay. My parents brought me out at a very young age to the sidewalk to offer hope and help to a woman that was going into abort. So I've been at this a really long time. And as Daniel said, I helped, my husband Mark and I helped with setting up Cities for Life and getting that ball rolling there. So that was quite a privilege. And then just to see where it has gone, what is amazing. We have 14 children. 3 of those children are adopted, and we have a whole bunch of children in heaven because of miscarriage. And one of those babies that we lost was an ectopic pregnancy. So, yeah, I can speak from experience coming from this. So
Yeah.
And it was Lisa that got me involved in Cities for Life, and ultimately in sidewalk counseling, and where we are today. So I really appreciate Lisa.
Oh.
So she's very special.
We do
lady.
appreciate you coming on.
Yeah.
Hey, you got 14 kids.
Yeah.
It's not easy to get away
Yeah.
from the house. I'm sure the opportunity to come and do a podcast here in the office was maybe just an opportunity that you seized, and you got one of the other kids to watch the rest of them. So
Little escape time.
Yeah, we do appreciate you coming. So I do want to, so that we don't go right into the issue of ectopic pregnancy, I want to talk a little bit about your experience, because I think we'll just capitalize on this moment. You
Right,
said you're second generation sidewalk counselor, so your parents were involved. Was it Operation Rescue?
That's right. They started when Operation Rescue began and kind of went from there into different opportunities.
Yeah.
Rally for Life, things
Yeah.
like that. So, yeah.
Yeah, and that was back in the 80s?
Late 80s. I think we got involved late 80s, early 90s.
Wow.
So,
yeah. And then you got involved, and then ultimately instrumental in starting Cities for Life, and now your kids, your daughter
My kids are
Caitlin-
out there. Yeah.
Your daughter Caitlin, who's what, she's 20?
21.
21, is out there almost every Saturday ministering on our Saturday team, and she's just a tremendous blessing. So there's like 3 generations. Man, we should do a podcast about that.
Yeah,
right?
the generation of
Actually, I do
sidewalk
want to do a
counseling.
podcast. Maybe you guys watch
Yeah.
out for that one about being raised in the pro-life movement. Maybe I'll get Caitlin. What do you think? You think she might want
Yep.
to do it?
Yeah.
Because I think that is a unique perspective. But yeah, I wanted to touch on that and just again give you guys, your family, props for what you did in starting Cities for Life, and ultimately has led to Love Life. Love Life sort of sprung out of Cities for Life in one sense, and then now Love Life is just going nationwide, and we're seeing
So
God.
exciting.
Yeah, we're seeing God raise up people all over the United States, all over the world. And I find myself actually, and I know you do too, Vicki, referencing things back to the OG crowd, to Lisa and to Jeanette, the Wilson family, to the Benhams, and just those who originally started some of the things that you guys put together. And I think maybe even this personhood
think it
initiative
is.
article.
Right. It was from them.
Yeah,
it
it's
was in
originally
our-
something
in
you
the
guys
files.
found and put it out.
Yeah.
So that all of our sidewalk counselors can be informed about this. So we do appreciate you. So let's talk about the issue of ectopic pregnancy.
Yeah.
First and foremost, what are we even talking about? What does this mean? Some people may not even know what this term means.
Right,
So
right.
let's let Lisa answer that question.
define what
Yeah.
what that is.
Ectopic pregnancy is a child that has been conceived, is already growing, but has implanted in somewhere other than the uterus. So that can be the fallopian tube, that can be the abdominal cavity, that can be in the ovary itself. So it's anything outside the uterus.
Yeah. Okay. And oftentimes, more often than anywhere else, it's actually the
In the
fallopian tube. Yeah.
Correct.
Although I've encountered situations, I had one, this was probably a year and a half or so ago, where a young man came over and told me his wife had an ectopic pregnancy. It was a cervical pregnancy,
yeah.
which is pretty dangerous. So there are other ectopic pregnancies, but if you encounter, and it is a small portion of pregnancies that are ectopic, but the larger portion of that small portion are in the fallopian tube. So that's mainly what we're going to be talking about, although there are other places where a baby could be placed
Right,
other than
right.
the uterus.
So, and of course, the danger is that the fallopian tube and all those other places, except if they somehow get into the abdomen, there isn't room to expand without that part of your body bursting.
Right.
And then the resultant hemorrhaging is the issue, right? So I don't know about what you knew prior to you becoming a mother, but my understanding of ectopic pregnancy before reading this article was that this was not only a death sentence for the mother, but a death sentence for the baby. So, of course, abortion almost sounds reasonable.
Right.
Or does sound reasonable if that's what you truly believe. They're both going to die, so at least save one, which would be the mother. So tell us about maybe just to kind of help us to understand what it is from a very personal experience to face an ectopic pregnancy, what you went through, what you
Right.
did, and then we'll go from there maybe to talk about some of the research that in this Personhood Initiative article that is really very eye-opening.
Right. Yeah. Well, this was back in 2006 when I found out I was pregnant. I was kind of surprised by it actually, because I had had 2 cycles before where I was pregnant, but didn't know it until after that second cycle. So it took me by surprise. I was shocked at the location of the baby. I'd actually had some pain. So I went into my OB. They did an ultrasound and they told me that the baby was growing and still had a heartbeat in the tube, in my fallopian tube. So
How far along were you at that point then?
I was about 8 weeks.
Wow.
Yeah.
Okay.
So that was a little bit scary. They were going to go in and they offered me 2 different options. They said surgery, which would probably be the better of the 2 options given the size of the baby. So they said surgery where they could either try to remove the baby from the tube or remove the tube completely. Or 2, give me a drug called methotrexate. So I knew immediately I didn't, coming from that pro-life background, that did not sit well.
Did they think that there was any way, like, did they ever mention anything, transplant, anything to give you any hope, or was it just the baby must be killed in order to save your life?
Yes.
Okay.
The baby, was going to die is what they told me.
Yeah.
Or I could die from, my tube rupturing,
Right.
Which they said could be any moment. And it's a scary place to be, but I knew because of my background, I knew because of what I knew about the Lord and what he said about giving and taking life, that wasn't in my control.
Mm-hmm.
I didn't want to take control over ending someone else's life.
Yeah.
And so I told the doctor that, and I don't think it came to a surprise to my doctor. They kind of knew exactly where I stood. They said, well, there is this other method of dealing with a tubal ectopic pregnancy, and that is called expectant management.
Mm-hmm.
I had never heard of this.
Right.
I didn't know a whole lot about ectopic pregnancy, but I knew enough to know that those were probably going to be the only 2 options I was given, the surgery and the methotrexate. And I said no. Mm-hmm. So they gave me this other option. They said, listen, we'll take your HCG levels. The baby probably won't survive. We'll do repeat ultrasound. You go home, be on bed rest, lie down, see what happens. And I obviously opted for that, knowing what I knew. And having the convictions I had, and I went home and waited it out. I went for repeat testing, and by that point, the baby had passed. So I rested fully in knowing that I had done everything I could do for that baby, and that I had chosen something that I could live with, where I could not have lived with choosing to have my baby forcibly removed or its life supply ended.
Yeah.
At my choice. So
How long was it from the point that you were told that you had an ectopic pregnancy to the point at which the baby had died?
it was actually only a couple days after that.
Only a couple of days.
Yes.
Do you know, and I don't know offhand, I don't mean to put you on the spot, but
Right.
do you know how often that happens, that the baby does indeed die?
It's pretty often because
Okay.
the baby's constricted.
Right.
And I think it actually says in that Personhood article right there about that,
Yeah.
the statistics.
Okay.
So
maybe
yeah.
we'll find that later as
Right.
we go through that. So did you have to have then surgery to have the baby removed? Is that a point at which can the baby pass naturally?
They told me that it would probably be reabsorbed.
Okay.
And so as far as I know, that's what happened. So.
Okay. So your tubes never ruptured?
Never
and
had a
you're-
rupture.
Okay.
Nope.
All right.
No, and I was told what to do when they sent me home, if I showed signs of rupture, what I should do.
Okay.
Yeah, and that's the important kind of point to this whole method is they're watching over, they're keeping a close eye. So it's called
Exactly.
expectant
Management.
So they're making sure that you're okay. They're kind of a wait and see option here. And again, the point is that you don't want to intentionally take the life of your child,
Exactly.
knowing what you know. Now, I do want to say this for people who have dealt with this. Maybe there's people that are listening that have dealt with this, that have had ectopic pregnancy, went to the doctor recommended this and that. And you can be in a position sometimes, especially when you're already kind of scared and shaken, to make a really rash decision. And doctors a lot of times are risk adverse, and so they're going to take the path of least resistance. And especially if they're not pro-life doctors, they're going to just, okay, well, when in doubt, take it out. And so maybe there's people that are listening that you kind of took that option. We don't want to bring any condemnation, any guilt, and say that, you know, Lisa's better than you or anything like that. No, thank God she dug a little deeper, and they talked about this expectant management, and, you know, it didn't work out good for the child, but it did work out good for you, and you don't have the guilt of knowing that you intentionally did that. Exactly. Those, again, who are listening, who maybe you don't know what you don't know. So if you didn't know this was an option, then how are you going to be able to access that option? However, now you know. And even talking to a mom, to kind of bring it around to really what we want is to help encourage sidewalk counselors, to help a mom who's telling you she has ectopic pregnancy to know that there's another option available to her, that she don't have to intentionally take the life of her child. She can kind of let, for lack of a better term, nature take its course or whatever. It is a way that you can talk to a mom in front of an abortion center about the issue of ectopic pregnancy.
And at least to get a second opinion. I mean, because I don't think women understand, you know, that there is this. And this is why I speak about it, because I know people that have personally gone through ectopic pregnancies, chose one of the options given to them, and they deal with that guilt. Well, I would just want people to know that there is another option that's not talked about a whole lot.
Right, right.
Yeah.
So talk a little bit about that, because I'm sure you have thought about this, that if there is an exception for abortion, if the life of the mother is in danger, what is that really saying about the value of that child's life?
Exactly. Well, I look at any of my other children, and which is more important, my life or my child's life? You know, my 2-year-old. You know, which life is more important? Neither. They're of equal value in God's eyes.
Right.
And that's how we have to look at anything, no matter where that child is located. That doesn't determine value.
Yeah.
That child is still valuable no matter where it is growing currently.
Yeah. So any of these exceptions, then it's important, I think, for us as sidewalk counselors to speak about that.
Yes.
That there is the tacit admission then that unborn baby is somehow of less value, and that's not biblical.
Yes.
So, and it fuels, I think, what happened in the issue of how to manage ectopic pregnancy. So, one of the things that this article brought out is, first of all, is it a death sentence? Because I think we all thought I did. We thought it was. It was a death sentence for the mom. Now, it was not a death sentence for you.
Correct.
The mom can die. I don't want to say she can't, but there is certainly research in this article that demonstrates that is not necessarily the case. That and the research is a little bit like convoluted and hard for me to summarize easily, but kind of in summary, one of the studies showed that in at least 99.6 of all the ruptured ectopic pregnancies in a study in southern Israel, they did not result in the death of the mom.
So it's not
that's
a
a
death
pretty high success rate, and they, I think in a lot of these cases, success is more pronounced and likely in the case of expectant management, what you did, and now autotransfusion. And I thought you had gone through that, but I guess I was incorrect
No, I
about
did
that.
not.
Okay.
But that is, and for autotransfusion, for those who don't understand what it is when the tube has ruptured and blood has flowed into the abdominal cavity, there are actually methods where they can take that blood out and reinsert it into the mother so that she's not bleeding to death. She's having her same blood put back through her system.
Right. So the idea that it is a death sentence for the mother is not necessarily true. It's not true. The research, and there is, and you can go through this, all of you people listening later on, because we will post this article. But then the second point that is often made is, okay, it's not necessarily that the mom will die, but what about the baby? Babies don't survive ectopic pregnancy, so why put the mother through risk for the death sentence of the baby?
Exactly.
Now, can you talk a little bit about that?
I can speak to that.
Okay.
Actually, I have a good friend. Her name is Reese, and she was an ectopic pregnancy.
Oh,
She was
interesting.
actually, she implanted in her mother's tube, and right at the end, right before, the tube leads to the uterus, and her mother was encouraged to abort and heavily pressured. And she said, no, I cannot do it. It is against my conscience. I cannot take the drugs. I cannot do the surgery.
Wow.
She waited, and that baby migrated, which does happen. The placenta migrates during pregnancy. That baby migrated to the uterus. And that is now my friend who's, 40 something years old and alive and well and has children. And, amazing things God has done because her mom placed her trust in Jesus instead of the medical doctors.
Such an awesome story, and that's what the research shows is that the baby has an amazing ability to transplant itself somewhere else. And there was one case described in this article of a baby that the tube actually ruptured. The mom survived, I assume through transfusion. The baby migrated into the abdomen and grew for 9 months and was delivered healthy by cesarean section, healthy full-term child that grew in the abdomen.
Yeah.
There is at least one recorded case of a baby that grew the full 9 months. Well, no, I'm not sure it was the full 9 months, but to the point of where they could take the baby out safely in the tube.
Right.
In the tube, and the tube did not rupture. So it kind of begs the question then of if the baby can transplant itself, why aren't doctors? We could make it to the moon. Why
Yes.
aren't we transplanting babies from the tube into the uterus?
And you have to realize it's a culture of death. And that little life is not important. That life is expendable. And that's not God's way.
Yeah, absolutely. It's one of the reasons why we're having this conversation is because we want we want to season this culture with the value of human life, because the more and more we, air quotes, progress as a culture, it seems the more and more we devalue human lives. So we've really not progressed. We've regressed. We've not gone the way that the Lord had wanted us to go. And in the medical community, that's the same way. I mean, in this article, which you're probably going to touch on, there have been cases where doctors successfully, in 1920 something?
Yeah, in 1917, a doctor 1917. I mean, that's 100 years ago. A doctor successfully transplanted a baby from the fallopian tube to the uterus, and that baby was born healthy and fine, I believe by C-section 9 months later. And that 100 years ago, and he thought this is the start of the whole new wave of how to deal with what was once a death sentence.
Yeah.
They thought was a death sentence. So why didn't that happen? So what else is happening in like the 1920s? Who's coming on the scene
I think
right around then?
There's a guy by the name of Adolf Hitler that's coming on the scene, but also you have Margaret Sanger who comes on the scene. And you really have this chipping away of the value of human life. And that's why we, as those who are believers in Jesus, and because we're believers in Jesus, we believe in the value of human life, that we have to uphold this standard, that we can't just be willy-nilly. And I understand, again, that there's differing opinions, and even within the pro-life medical community about ectopic pregnancy and how you deal with that. I understand that. But it can't just be a light and kind of glib thing. Oh, yeah, ectopic pregnancy, well, then we've got to do these other methods where the baby ultimately has to be intentionally killed. No, if we're going to hang on to this value of human life and uphold the standard of God, we need to be very careful in the way that we approach any subject that has to do with human life. Even getting into the realm of not the rabbit trail, but assisted suicide and stuff like that. There's even Christians that are toying with the idea that this might be a moral thing to allow people to be assisted in suicide. So, again, it's a chipping away of the value of human life. And whereas you had a doctor in 1917 that was willing to take the risk and to do this procedure and ultimately with good results, now you've got doctors now that are not even willing to consider what you're even talking about, which is expectant management. And so it really is, again, if we're going to uphold this standard, we need to stand firm And that's why it's helpful to have articles like this and to have podcasts like this that are encouraging you to do that, and so that you can be well informed, because a lot of Christians have no clue about some of the stuff that we're talking about.
Right. What did you face when you're talking to your doctors, your family, your friends, your husband, and you're saying, this is my decision? Was there an overwhelming support for a decision to follow that approach, or was there still pressure? You're going to die, Lisa, and we don't want you to die. We love you.
I have such a supportive family, and they're all followers of Jesus. So because of that, they supported me in affirming life and not killing my baby.
Yeah.
So thankfully I had that support, but had I not had that support, I still would have stood my ground and done what I knew I needed to do in God's eyes.
So can you imagine what do you think is happening to the moms
They're feeling a lot of
in
pressure.
a very strong abortion-minded culture?
Yes, they're feeling a lot of pressure.
Yeah.
So yeah, we need to be there to support them and to educate them, and things like this does that. So.
Yeah. Do we know of pro-life doctors who are aware of expectant management and are supportive? And
We have some locally that are
Okay.
aware of that and
Yeah.
who would institute that.
Are
in
they
many of
hard
those
to find?
They are hard to find.
Yeah.
And you might, like I said, they never gave me that option. I had
Right.
to push back on the other two options that I was given in order to learn about expectant management. So if you're ever faced with this, guys, you need to know that it is an option, and you need to press your doctor for that, for that option to be given to you.
Yeah,
So
and at least information.
yes, and then if
about
they
that.
don't give it, go to another doctor.
Yeah.
Until you find someone that's willing to support you in your convictions.
Right.
I think one of the points here in any, especially this, but any of the kind of high risk, difficult situations, and we train our sidewalk counselors and the sidewalk missionaries that we're bringing in to Charlotte to deal with the hard cases. And any of these hard cases, especially, again, the medical ones, or, fetal diagnosis like, Down syndrome or whatever, we're always encouraging a second opinion.
Yes.
And with this especially, it's like, well, get a second opinion, because we've had situations where we've had moms that were sent by their OB doctor to the abortion clinic. And that happens a lot, guys. It happens a lot, where doctors will send a mom to an abortion clinic because it's a lot cheaper. I mean, let's face it, to go to the hospital and have all that, even if they're we've had doctors send a woman who they said was miscarrying to the abortion center, rather than her going to the hospital and having a DNC. She could have a DNC at the abortion clinic here for like $400. And I remember one young lady, she drove all the way from Virginia to come here, was told by her doctor that she was miscarrying, that her baby is already dead. Thank God we got her on the mobile unit, and she ended up seeing that her baby was actually alive, and she left, not having killed her child. Doctors are wrong sometimes. Doctors sometimes, I'm not saying all doctors or even most doctors, some doctors have agendas too, and we need to be careful for that. And opening up the door to a second opinion, it can't hurt, right? To be able to at least have a second opinion, because there is guilt associated with having abortions. Whether or not our culture says that's true or not, it's a reality.
Yeah. Was your doctor concerned at all about a lawsuit?
I think so. I think most doctors are.
Right.
Because that's immediately why they're going to go for the quick fix. Let's get it done so that
Right.
we're not facing the risks of
Right.
expectant management, because there are risks involved. If something were to happen,
Right.
my husband could turn around and sue them.
Right.
So I always encourage people, if you're serious about this and your doctor's at all hesitant, assure them a lawsuit's not going to happen if something were to happen to me.
Right, right. And in this article, it talks about that it is part of the medical, I don't know if insurance, policy, whatever, that a doctor, if he has two patients, he is not expected to give equal time and treatment to both patients. He's expected to do whatever he needs to do to prioritize, to save the patient he's most likely to save if he's going to lose
Like
one.
triage.
And he is not sued. He is not suable. I don't know what, liable for maybe the fact that one patient died because he had to attend to the needs of the other. So doctors are really looking at two patients when they're looking at a mom with a ectopic pregnancy, but they're not really, most doctors are not viewing it that way. They're looking at the mom is their patient. So what does that say about what they're viewing
Exactly.
the baby as?
Right.
And obviously not a person, not a person, which is why this is the personhood initiative, because this really does change the kind of the whole scope of the discussion.
Exactly.
Right? So, can you talk about some of the strengthening biblical, support that you found during that time? I'm sure it was still a hard
It was
few
scary.
days or whatever, and
Yes.
frightening.
Yes, it was scary,
Yeah.
but I mean, you just got to go back to scripture and ask yourself, what would God have me to do? Well, he's very clear, thou shalt not kill. There's no ifs, ands, or buts. So
Right.
that was the primary foundation for making the decision I did. But some comforting things, that I found, particularly Psalm 31:15 says, my time is in your hands. So
That's
the
a
Lord
really
has
good
our
one.
days numbered, and we have to trust in him that because we are his child and because our days are already numbered, we're exactly where God would have us to be.
Yeah.
Now, if we step outside of that and we commit murder, we allow someone to take that baby too early, then those days might be numbered less than they should have been.
Right.
So
Yeah.
why put yourself at risk? The safest place to be is in the middle of God's will.
Yeah.
So-
yeah. And you weren't making a thoughtless or foolish decision either. You had scriptural support, but you also
Right.
had researched. You knew some of what you could suggest to the doctor.
Right.
So you were armed with knowledge.
Right.
You're armed
And
with
that's so
scripture.
key to know. And that's why I like to
Yeah.
speak about it,
Yeah.
to others so that they are armed if they're ever faced with
Yeah.
something like this.
Yeah. And you've had other high-risk pregnancies, haven't you?
Right. Right. Yeah, I
So
do. I have.
You've dealt with a lot, so you could speak knowledgeably about this whole exception of the life of a mother.
Right. My life is of equal worth in God's eyes as my baby's. So
Yeah.
unborn or born. So
Yeah.
always let the Lord have control of that, and he'll guide you. He'll, you're safest in the palm of his hand right there in the middle of his will. So
Right.
Amen.
Yeah.
Well, you certainly practice what you preach, and we should. And I think this conversation will help others to continue to just uphold the value of human life, because it can create some dilemmas in our minds when we start to kind of chip away at that value of human life and we start to leave exceptions. I mean, the reality is that Roe v. Wade back in 1973 was based solely on the exceptions, the things that a lot of people that would say even that they're pro-life would leave as exceptions for abortions. But
Which
if
are
the
less
whole
than
point-
1%
Yeah,
of all the reason for abortion, these exceptions.
Yeah. So rape, incest,
Right.
the health of the mother.
Right.
Those are the things that open the floodgates of ultimately nationwide child sacrifice at these abortion centers. And so as pro-lifers, as people that believe, as Christians that believe that human life has value, those exceptions can't be something that we stand on, something that we allow. We have to uphold the standard of truth that God is in charge. He is the one that holds life and death in his hands, and we as a society don't have a right to take the innocent lives of children, even if there's some extenuating circumstances. Just dealing quickly with the issue of rape, because that is probably the biggest exception that we hear.
Right.
Well, I
Right.
was raped, so therefore it's okay. But a child who's a result of rape is no different than a child who's not. If I were to show you a baby in the womb that was a result of rape and a baby in the womb that was not, you would see no difference. And in the same way, a baby that's conceived and ends up in ectopic pregnancy situation is no less valuable than a baby that's in the uterus. Your location does not determine your value. Yes, again, it's a difficult situation, but we need to approach that situation from a biblical and God-honoring perspective. And I believe what you've shared has been just that.
Yeah. Can I ask you, just because as he was talking, I was thinking back to your experience, and you had just a couple of days that before you knew that your child had died. But in the case of a mom whose child is still growing in the tube, what do they tell you? Because I'm sure they did tell you. What do you look for? What are you, in your expectant management, what sorts of things are you to be aware of to protect yourself and to know when to call the doctor, when to go to the ER, whatever.
Well, you're being pretty closely monitored. So they're taking your HCG levels every other day. If they're dropping, obviously the baby is in the process of dying, or is already gone. But if they're climbing, of course, the baby's growing. That determines a lot of things right there as to what they'll tell you to look for.
Okay.
But bleeding would be a major thing. Increased pain and cramping would be something to look for. And then they would instruct you to go to the emergency room at that point. So
And how much time do you have? Say when these symptoms, as they're accelerating.
it depends at how badly the tube has ruptured, because sometimes
Okay.
it can just be a little nick, in the tube,
okay.
or it can really, be much more serious, get, some
Okay.
kind of a blood vessel or whatever, and that can be much more serious. So it really depends. Some ruptures are worse than others.
Yeah. Yeah. Do they hospitalize moms sometimes
They
and
do.
keep them in the hospital for that expectant
Yes.
management time?
Yes, especially if the baby's bigger.
All
So
right.
yeah,
Yeah.
they would.
Before we wrap this up, and you may or may not be able to share, but if you can, please share, maybe without giving specifics, a situation you've encountered with a mom that has had an ectopic pregnancy at the abortion center, or somehow you are connected with that person, and how you kind of talk them through and walk them through that situation.
Well, I'm always quick to point out, if your doctor has told you you have a tubal ectopic pregnancy and you're coming to an ambulatory surgical center for an abortion, what procedure are they going to do on you in there? Normally, they're telling me that they're coming for a surgical abortion. Well, that just sends up a bunch of red flags, because if the baby's outside of the uterus, you can't do a surgical abortion. Now, if they're telling them to go there for a medical abortion, even that has some really iffy things, because you're going home to labor and deliver that baby on your own. And so I'm pointing out these cracks in their treatment plan to where that mom could end up harmed anyway, doing the medical abortion or going through with a surgical abortion where that baby's still growing in that tube and didn't solve anything they thought they were going to solve. So you really got to dig deep and see what they've been told, where the location of the baby is, which is why it's always good to get a second opinion to make sure that baby is where they said it was. And then I just remind them that it's not within our control, or it's not been given to us by God to call whether or not this baby should be executed. And we are only supposed to support life, and we need to find someone who's going to back us up, and align, who has the treatment plan that aligns with God's. So I'm always just quick to get them into a second opinion to a good doctor who's going to determine what's best for them and what's best for that baby.
Yeah. I mean, it's certainly a situation where, I've encountered these situations, and it's never, if it's a real situation, because sometimes I've been lied to. I know you have too, Vicki. I'm sure you have too. Where
Yeah, I was
they
thinking
told
if she
you-
was talking with her questions to them, I'm sure you've uncovered people that you thought, this is just another excuse. Right?
Yeah. I mean, they're really trying to make you feel bad for talking to them about going into the abortion center. But in the situations where I've encountered, and they've been very few and far between, where it's been legit and it's been a genuine situation, it's never that they're coming to me and talking to me in some proud and arrogant way. They're already broken.
Yes.
Right? There's already a heaviness about them. And I make sure and just be very intentional with my language. I'm not coming across as condemning or as judgy or whatever. We want to identify. And again, we train folks in all of these hard cases to have compassion, to identify with their struggle and all of that. But it really gets to the point where when I'm talking to a mom going into an abortion center, or a dad whose girlfriend or wife is going into the abortion center, is that you're going into a place of darkness. You're going into a place of death.
Yeah.
I know you probably wanted to keep this baby. That's oftentimes the case in these situations I've encountered. And so you want to keep this child, and you're brokenhearted because you're not going to be able to. You don't think that you're going to be able to. You're going into a place full of people that don't want to keep their children. You're subjecting yourself to doctors. I mean, wow, if you go through the track record of some of these doctors, as a matter of fact, one of the doctors here at the Latrobe Abortion Center is actually responsible for the death of a woman. I don't know if you knew this, but a woman came to his clinic and had an ectopic pregnancy. This is like 2006. And he gave her the abortion pill. And then she came back because she was still pregnant. The abortion pill apparently didn't work. And so he gave a surgical abortion to an empty uterus. He didn't do his due diligence and find out that she had an ectopic pregnancy.
Well, because the abortion pill will never work on
Yeah.
on an ectopic pregnancy. It's a different pill,
Correct.
than what?
Yeah.
Yeah.
So she ultimately, as far as the little bit of digging that we've done, her fallopian tube ruptured and she died. She bled to death. So you don't want abortionists, people that get paid to kill people's children, to oversee your ectopic pregnancy, right? If that's a genuine thing that you're dealing with, or that a mom that, as a sidewalk counselor, that you're ministering to, then she needs to go to a real doctor. She needs to be overseen by a hospital or by a real doctor, not an abortion clinic, not an abortionist.
And I will say, if you've been referred to an abortion clinic by your doctor because they tell you that that pregnancy is out of the uterus, is an ectopic pregnancy, that should send up some warning flags to you,
Oh,
because
absolutely.
Yes.
no good doctor is going to do that in the case of an ectopic pregnancy.
Yeah.
Yes.
Yeah.
Exactly. Sadly, I mean, the abortion center is probably the cheapest place for them to go and have that baby
Right.
removed,
Right.
as opposed to the
But
hospital.
it can't even be done in ectopic circumstances.
Right,
So
right.
Kind of,
Right.
you got to think,
Right.
why do they want me
Yeah.
here?
Yeah.
Only if I guess they would refer only if, I'm assuming, unless they're a really terrible doctor, they are referring, correct me if I'm wrong, if the baby is so small, so young that the medication can still be safely taken. Is that
It might
correct?
be, yes.
Okay.
Yes. Although you should still be under the care of a doctor
Surely.
after the methotrexate is given. And I don't think that's the drug they use there anyway. So
Yeah. Yeah.
All right. Well, we hope we gave you guys some information to chew on, to think about, to pray about. And we hope you guys will dig into this article that we're going to post. It's called Ectopic Personhood, and it's from the Personhood Initiative. So if for some reason you guys don't see it in the show notes of this podcast, maybe you're accessing this podcast on some other platform than Apple Podcasts, certainly you can just Google search it and you'll find it. Share this podcast with folks that you know. Maybe it'll be a blessing to someone. And reach out to us. You can reach out to me, dparks@citiesforlife.com. You can reach out to her, vcasiorg@citiesforlife.com. We'd love to hear from you guys. We'd love to hear some suggestions of topics that we can cover. And we'd love to hear what you guys think about the podcast, maybe some things we can improve. And just before I wrap it up, I want to thank you again, Lisa, for coming.
Thank you.
I appreciate you taking time away from your family to come and share. And again, just to end it off, we're not medical professionals. So we're not pretending to be. We don't play medical professionals on TV. This is not a medical professional podcast, but it is a gospel-centered pro-life podcast. And so we hope it was a blessing to you guys. And so until next time, God bless.
Give me an outlet for love. Give me an outlet for gratitude. I know it will cost me my life, but nothing's too precious since I met you.